My name is Dustin Sulak. I'm an osteopathic physician. I'm a general practitioner in Maine. And I do traditional osteopathy, which is hands-on medicine. I use my hands to facilitate the healing system in the body. And I do integrative medicine. And part of that is herbs and medical marijuana. Most of my patients bring medical marijuana to me through stories of success with it. I started in residency, in the residency clinic. There's occasionally a patient where I'm the primary care provider for someone who also has MS or inflammatory bowel disease or chronic pain, and they tell me what works for them. But when I look more closely at this herb and a couple other things that have come up recently, vitamin D being the other one, especially in Maine for people that are vitamin D deficient, these basic substances and very complex plant medicines can really help almost every condition because they work at the level of optimizing the healing system. And when the healing system works well, people get better. It doesn't matter what it is. The body can heal itself. The mind can heal itself. And it's usually with medical marijuana, once in a while there's a patient that actually might seem like it's a cure, but it's usually not. It's usually a vast improvement in their symptoms and their quality of life and their ability to function in life. I see that with chronic pain a lot, different types of pain too, neuropathic pain, back pain. I see it with MS probably the most. I know that's the one that's talked about the most because I think clinically we see that the most. That someone who was wearing diapers before marijuana is not after, or that was in a wheelchair before can walk now. That's where you really see a lot of the dramatic changes in MS patients, seizure disorders. People that have had 3 seizures a week for 20 years are now having 1 a month. Maybe I've got several patients that basically fall into that description. These people know the difference between what their life is like with marijuana and without, unfortunately, because they've had to experience the effects of prohibition on their medical condition. And so they've tested it out by need, and they know that when they can't get their herb from the underground market, or when it's just not available because it's too expensive or for whatever reason, they see what happens in their body.